Hi, this is Mr. H. I want to thank the Hot 120 Degree staff for inviting me out to talk about the hot topics. There's a lot going on in the world, and today I just want to update you on the coronavirus and tell you some things that you need to know. The coronavirus is basically has shut down the world for the most part, and a lot of people are afraid, and a lot of people don't know exactly what to do in order to survive this crisis. So I put this video together to give you some thorough insight, to empower you, to inform you, to get you away from the fear and move you into a plan of action. So we're going to talk about the coronavirus, but not from a fear perspective, but from a plan of action perspective, and just give you some insight. Things you need to know. Why is it called a coronavirus? Number of cases worldwide. What country has the best approach to the virus? Safest place on the planet. Things you can do to protect your family. These are all the things that we're going to talk about in this video. So if I was you, I would watch it from the beginning to the end. Why is it called the coronavirus? Well, remember, I think around 2002, SARS came out, and that was a severe acute respiratory syndrome, and that was in China, and they were able to contain it, and they haven't seen too many cases since 2004. Remember that? Also remember around 2012 in Saudi Arabia, MERS came or emerged, and that was the Middle Eastern respiratory syndrome. Well, many of you probably didn't know that both of those were coronavirus. Okay. This virus is different and hard to contain because the virus, via its evolution, has smartened itself up. And what it has learned to do is to hide itself for 14 days or so in a host, which would be a human being at this point, without ill affecting that human being. Let me say that again. It will hide itself in a host, which would be a human being, okay, in that human being for 14 days without ill affecting that human being, which means that human being would have spread that virus to other people over that 14 days without knowing that they had it. Hence why everybody is saying you need a quarantine for 14 days. Well, those are coronaviruses. So why is it called corona? Interesting. It's based on the format of the virus. Corona in Latin stands for crown or king. Okay. When you look at the virus, you'll see little crowns on top of it, right? So therefore they call it corona based on the crowns on top of the virus, or the cells of the virus, right? Of the virus. Has nothing to do with location, has nothing to do that it came from Wuhan, China, has nothing to do with the fact that many believe that this virus came out of bats. Nothing to do with that. The name corona has something to do with the structure of the virus and its crown-like shapes that are kind of on top of the virus. Everybody got that? Okay. So that's why it's called corona. Now, how has the virus spread worldwide? And this is interesting here. This is interesting. This is what you You got to understand this, because this is where you can learn to come out of the fear and really get to what's happening. So what we did for Hot 120, we didn't go to every city, we didn't go to every state. We just hit it from the 7 continents. Okay. First is Africa. Africa has 2,380 cases confirmed, 64 deaths, 140 recovered. Now I'm gonna show you a pattern here in a minute. Just follow me on these numbers. Europe has 218,170 cases confirmed, 11,957 deaths, 19,678 recovered. Asia, which is the place that it hit first. Remember Wuhan, China, 130,775 cases confirmed, 5,606 deaths, recovered 87,568. Australia, 2,431 cases confirmed, 9 deaths, 155 recovered. Antarctica, 0 cases. North America. Now, with North America, we broke it down in two because you got Canada and United States, and both of those are considered North America. Okay. So the U.S. is 59,000 cases, 828 deaths, 508 recovered. Okay. Canada, 2,786 confirmed cases, 26 deaths, 185 recovered. South America, 4,581 deaths. No, pardon me. Those are cases confirmed. 58 deaths and 74 recovered. Okay. Now, when you look at this and you start to look at the numbers, right? Got to know your numbers. You'll see that more people recover from this virus than those that die. Let me say that again. When you look at the numbers on the continent, you'll see that more people are recovering from this virus than dying. So that's good news. Okay. Second of all, you see that Antarctica is the safest place, and I guess it's because it's the coldest place and nobody's going there. Okay. The other thing that's interesting, though, when you look at the recovery and you look at the deaths and you compare the continents, you'll see that all the other continents except North America, particularly the United States, the recoveries were higher than the recoveries were greater than the deaths, right? So you look at Africa, 140 recovered, 64 deaths. Let's go look at Europe. 11,000 dead, 19,000 recovered. You look at Australia, 155 recovered, 9 deaths. But when you look at America, their recovery is not really outpacing the deaths. And I point that out because, number two, I live in America. The other thing is, this is the superpower of the world. And it seems as a superpower, America was not ready or made some missteps when it comes to this virus. Those numbers, those recovery numbers should be higher than the deaths with all the resources that America supposedly has. So I just wanted to point that out. All right, let's move on. Now, what country has the best approach? South Korea has the best approach. That's your answer flat out. South Korea has the best approach. The virus hit them early. They understood it and they respond in such a way. And this is how they respond. They had mass production of test kits days after the first case was found. So as soon as the first case was found, they got together and met, and they said mass production of test kits. Okay. They identified 909 cases in one day. Okay. Another thing they were able to do, they were able to track their hotspot or their epicenter, right, of the virus to a local church, and they knew that everybody that was functioning out of that local church was getting the virus. So then they begin to track everybody from that local church and track everything that they were, all the other people that was coming in contact. Let me go further. We'll talk a little further about that. They did all this without China's harsh restriction. China didn't want you to speak to other people. They didn't want you next to other people. They didn't want you speaking, and they didn't want you moving about. They also did it without the economically destructive stay-in-the-house policies like Europe and America. South Korea got this thing figured out. They had fast action, so they moved swiftly. They had fast action, and they did widespread testing. This is important. They were not just making tests for people that was infected. Their approach is what I said on Facebook a couple of days ago. They assumed that everybody was going to get the disease. So therefore, they did widespread testing and put up testing centers so everybody can get tested, not just people who we think might be ill. And this is where other countries have made the misstep. And as a result, they are not controlling or containing the spread of the virus because they're only focusing on people that show symptoms. They're not testing those who don't have symptoms. So therefore, they don't really know where the hot spots are, or for them to learn the hot spots, it takes them a long time because they're only testing people that show up sick. But we know and understand that this strand of the coronavirus, okay, COVID-19, does not show symptoms for 14 days. Therefore, somebody that appear to be healthy can have it, and they don't know. So this is where South Korea got it right. We're going to test everybody we can to slow down this virus. Critical support from citizens, which means that the citizens supported the government 100%. That's hard to do in other countries because a lot of other countries distrust their government, but the South Korean seem to have a high trust level for their government. And now the country produces 100 test kits per day, 100,000 test kits per day. And the other thing is, okay, and you can see this with Canada as well, right? That's why you got to do the numbers, because when you do the numbers, you see patterns. Canada sort of has a nationalized healthcare system. Their numbers is low in reference to this virus. South Korea, because they do have a nationalized healthcare system, they were able to flatten the curve on the virus. So it's interesting that the countries with their national healthcare system are better prepared to respond to the virus, and it's because most people in those countries have access to healthcare and are not going to be denied care, and therefore are able to get to the testing. So then that was interesting to me that the two countries with the nationalized healthcare system, there may be others, their numbers seem to be low, or the people seem to be more empowered in reference to responding to the virus. Now, the other thing that was unique about South Korea, they use cell phone and credit card tracking of the infected to do contact tracing. So basically, and pardon me if this camera is moving, but I'm in a car. Basically, if they knew you had the virus, right, they track your cell phone to see where you were going. And then if they track your credit card if you spent. And so wherever you went, that's where they went to do testing. Right? They didn't try to stop you from moving. They just know wherever you move, we're going to set testing centers up there, and therefore we'll set testing centers up there, and therefore we are actually contact tracing, and we're actually beating the disease, beating the virus to its destination before it gets there because we're testing people early and allowing them to know their hot spots and allowing them to control the virus. Now, some of the people who tested negative may become positive, and so China got to keep their eyes out for any rebound occurrences of the virus. But when you look at the globe, and you understand what happened in Italy, see what was going on in France, you see what was going on in Europe, okay? South Korea has the best plan, best approach, best method. Now, Russia has low numbers as well, but there's suspicion that Russia is not reporting the whole thing. They're not reporting on the crisis like they should. Okay. So South Korea has the best approach. America, in humility, should follow their steps. Now, it might be a little bit too late for America to control it that way because they allow it to spread. The first couple of days of it hitting America, they allow it to spread without putting a plan in place to curtail it. And this is why they're coming up with a lot of draconian rules. Stay in the house, don't do this, do that, and the economy's going down. So will America beat this disease? I think we will overcome it. But I think we got a long curve ahead of us because of our slow, inconsistent message and actions by those in leadership not understanding how to respond to this crisis. Now, how can you keep yourself safe? Well, let's understand. Let's deal with some myths, okay? Let's deal with some statistics to keep you safe. We know and understand, okay, that 50% of the people that get this virus are between the ages of 18 to 44. Okay. We know and understand that most people that die from this have underlying conditions. Some of those are elderly, some of those have diabetes, high blood pressure, heart disease, or any underlying condition, pre-existing condition that causes the immune system to be compromised and not able to fight the virus. We know and understand that those with a healthy immune system, most of them recover from the virus. So that should just take the fear out of it. We also know that as of yesterday, one teenager, I think it was 18 years old, has died of the virus. So we know that the virus impacts young people. So this is what you have to do. You have to stay on top of your hygienes. Okay? Got to wash your hands. If you were washing your hands 5 times a day, you got to wash your hands 10 times a day. But I also say you got to wash your face because the portal and for the virus to get in is through the nose, the eyes, the mouth. Okay? So you got to wash your face. If you wear glasses, I know I was talking to a couple friends of mine and they were putting their glasses in like diluted bleach so that they can take the, so that the virus don't be on the glasses. So you got to clean your glasses. If it's cardboard, it's 24 hours. They say it's survival that surface 24. So you can just spray that with Lysol. If it's a metal surface that you're around, disinfect it. Disinfect it. Body's supposed to last on that every 3 days. So you want to clean that. If it lasts every 3 days, then you should at least wipe that down every 24 hours. Okay? Now, as far as food, right? The economy shut down, food can't get where it's going, mass production goes down, economy goes bad, and you can't get food. This is what you need. You go to places they might not have, chicken or meats and stuff. All you need is eggs, oodles of noodles, some water, okay? And that's just the basics. I mean, you can survive off that. And vegetables. Okay, you can freeze your vegetables, or they might have canned vegetables. Vegetables can last, if they're frozen, they can last long. So there might be a period where you might have to go without meat. You can go without meat. If you got your eggs, your oodles and noodles, your water, and your vegetables, you will survive. Okay. If you have medicine, you need medicine. Um, Make sure you use it wisely. You understand? So that it can spread. The key here is not to panic. If you don't have meat, you can survive. If you don't have juice, you can survive. But if you live in the hood, this might be the time to rack up on Kool-Aid, because all you need is water and sugar. Put some Kool-Aid in there and you got juice. Okay? All right. Um, Toilet paper. You got to figure out how much toilet paper you need to last a month. Some houses, 1 pack, 12 rolls can last a month. Some houses need 2 packs. You got to figure that out. You don't need to go out and get 50 packs. You don't need to go out and get 50 packs. And the key thing is here, we want to reduce our interactions with the elderly. And what I mean unnecessary interactions, we got to make sure they're eating, make sure they're getting their medicine and all that. But you want to reduce your interactions with the elderly so that their immune system will not be compromised. We got to keep our eyes on our children, make sure they're washing their hands and being sanitized. Okay. If we're going around the sick, that's when we need a face mask and the gloves. You don't need all that stuff if you're not going around anybody that's sick. If you are sick, you need a face mask, hands, and gloves as well. We have to support the government, but we need to be pushing them to produce test kits faster and vaccine faster. I'm not so much with the social distancing, staying in the house stuff, because that's slowing down the economy and that's causing that's hurting the country. I think we need to do it to curb the virus, but I'm not in support of that being a long-term thing, because again, most of the people that get the virus recover from it. So if this country, meaning the United States, wanted to do something, they would tell those who have underlying conditions, those that are elderly, that they would need to maybe stay in the house or quarantine until we flatten the curve on the virus. That's just my feel. Again, you will survive if you don't panic. You will survive if you're not afraid. Those of us whose immune system is not compromised, recover from this virus more than those who die. Okay. Now, I'm Mr. H. This is Hot 120 Degrees. We will continue to report on the coronavirus. We just wanted to do this so that you can get some insight of what's going on and stop panicking and stop blaming and stop being frustrated and stressed out. Okay. And we would like you to subscribe to our channel. Push the bell so you can get notified every time we post new content. And we would like to hear your questions and comments. So please, as you subscribe, please put your comments, your questions, and insight in the comment section. Be diligent. Be strong. Be aware. Peace.